Hi, and welcome to the VieSID Press-release. With this short presentation, we want to report on the dental literature published in November 2021. We have chosen articles from a selected list of journals that we think might be of interest to the VieSID community. In the Journal of Oral Rehabilitation, Heckman, Eriksson, and colleagues investigated the association between TMD pain and catastrophic thinking, including rumination, exaggeration, and helplessness. The authors selected TMD and controlled subjects from the Swedish Public Dental Service database and invited them for a clinical examination, which was conducted based on the diagnostic criteria for temporomandibular disorders. The subjects were evaluated using the pain catastrophizing scale, and they found then that the overall level of pain catastrophizing was generally low in the sample considered, although a low but significant correlation was found between pain intensity and catastrophic thinking. Instead, the association to jaw function was weak, and no association was found between pain catastrophizing and number of painful sites. Ekman Eriksson and colleagues concluded that pain catastrophizing should be included in the DC-TMD axis 2 assessment because it is part of the clinical picture of TMD. To better understand the reason for the weak association between TMD pain and catastrophic thinking in this study, it is important to consider that the individuals were selected from the community rather than from the clinical settings, and so it is to be expected that although diagnosed with TMD, they might not have necessarily shown severe symptoms. Also, catastrophic thinking might be associated with chronic pain rather than pain intensity, but the information presented in this article does not allow further consideration on this aspect. Mulerinho Alves et al. Investigated the effects of physiotherapy and aerobic exercise on myalgia patients over 8 weeks. The physical therapy session was performed weekly for 30 minutes and consisted in compression, transverse and longitudinal massage of the masseter muscles, longitudinal massage of temporal muscles, compression of the medial pterygoid muscles, passive stretching of the masseter and medial pterygoid muscles, isotonic strengthening exercise through resisted mouth opening and closing, and resisted left and right deviation. Instead, the aerobic exercise consisted of a 30-minute session on an ergometer twice a week. Mulerinho Alves et al. Considered 45 patients, which were divided into 3 groups. The first group was treated with physiotherapy. The second group received physiotherapy treatment and performed aerobic exercise, and the third performed only aerobic exercise. Patients participated in the physiotherapy program and combined physiotherapy and aerobic program showed a significant and stable reduction of pain, while aerobic exercise alone was not effective. So the patients also experienced a general improvement in the quality of oral health, although the reduction of pain did not seem to affect the level of anxiety. Physical therapy and aerobic exercise proved to effectively decrease the level of pain in myalgia patients, at least in combination, and in the short term. It can be further discussed whether they could be considered medium and long-term solutions as well. Ogava et al. Investigated the movements of the tongue to achieve bolus formation and transport. Particularly, their interest was on the stage 2 transport, namely the phase in which the tongue presses the bolus into the pharynx by a squeeze back motion. They observed 10 adult individuals chewing on a standardized food sample while recording the pressure exerted on the palate by the tongue using a swallow scan tactile sensor system. They found that the tongue frequently touches the central and posterior regions of the hard palate, as well as its habitual masticatory side. Instead, the stronger pressure is applied anteriorly and centrally. However, of the 10 individuals examined, 2 did not show a typical stage 2 transport. So further investigation will be needed to unravel the origin of variation in tug movements, especially in relation to occlusion. Schimmer et al. Discussed orofacial health in the light of the Mai-Kirk model of health, which was put forward by Bircher and Hahn in 2016, based on observation on the UK health system, which, according to the authors, fails to address the needs of the general public. This model states that, and I quote now Birken and Hahn, health is a dynamic state of well-being emergent from conducive interactions between individuals' potentials, life's demands, and social and environmental determinants. So health is a complex active system that evolves throughout the whole lifetime of an individual. So Schimmer and colleagues commented on some of the conditions generating a decline of oral health in modern humans, especially in relation to mastication and due to old age, namely to a gradual loss of the biological given determinants of health in the occurrence of diseases. So the topic raised by the authors is of interest because oral diseases receive generally less consideration than other non-communicable diseases. Thus, it deserves further attention and development. In particular, it would be interesting to discuss how orofacial health care could be improved in the light of the Mai-Kirk model of health. Again, I quote Birker et Hahn here. The Mai-Kirk model is an innovative definition of health that summarizes the different mechanisms for the improvement or deterioration of health. It may unite all responsible persons in healthcare, including patients, in a well-described and shared objective or goal that is health. So thus, in my opinion, the discussion by Schimmer et al. Should be extended to how orofacial diseases could be prevented, since the Mai-Kirk model of health puts great emphasis on prevention. Also, by recognizing the complexity of health and disease, the Mai-Kirk model stresses the joint responsibility of the healthcare professionals, considering the patient and active players too, and highlights how the healthcare system should improve by generating awareness in the general public about prevention, pathologies, and corresponding treatment options. So we should all make an effort and ponder on how facial or orofacial health care could be improved in the light of the Mai-Kirk model. In the Journal of Craniomandibular Function, Stimmer et al. Published a systematic review on the efficacies of occlusal splint in active maximum mouth opening in TMD patients. They consider eventually 21 studies selected out of over 2,600 screened. Although they did not show a positive effect of occlusal splint over other active treatment, including physiotherapy, massage, and jaw therapy, in the case of limited mouth opening and of arthrogenous nature. A most interesting and well-written article by Saratti et al. Was published in the Quintessence International. In this paper, which is an opinion paper, the authors discuss the gnatological concepts in an historical perspective. Accordingly, they saw the rationale behind the gnatological concept as originating from practical needs of prosthodontic reconstruction in edentulous patients. They discussed the gnatological pillars of centric relation, vertical occlusion dimension, anterior and lateral guidance, and posterior occlusal support in the light of the current evidence-based knowledge or lack thereof, and concluded that these fundamentals should be considered as guidelines rather than dogmas. especially considering the high degree of variation characteristic of humans, not only from individuals to individuals, but also through the lifespan of the same individual. Also, they highlighted other factors such as the adaptability of the stomatognatic system, and discussed problems of modern dentistry in relation to modern diet and the changes that this has caused in the configuration of and function of the modern human stomatognatic system. So this paper leaves more open questions than it manages to answer, I am afraid, but the authors cannot be considered at fault for this. Rather, this reflects the fact that the field of occlusal medicine is still in the making and much work is still needed to advance this discipline. So this presentation ends here. I invite you to contact us in case you want to know more about our activities. So otherwise, be ready for next month's press release. See you soon.